Good Saturday morning to you, and welcome to The Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. Dr. Brenner has an office just off of Route 4 in Burlington, hence the name of her website, theburlingtondentist.com. And you might be saying, oh, I thought I just tuned into a sleep show, not a dental show. And I say this all the time. There is such a strong link between dentistry and sleep disorders. And that's the whole premise of the show. More importantly, I'm going to give you a phone number. And the reason why I say more importantly is because at the end of this show, the first 5 callers will receive a free sleep assessment. And if you're saying, well, can I use it for my husband or for my child? Absolutely. It doesn't necessarily have to be you. It can be for a loved one. She puts a value of $250 on it. I know what it entails. I say it's probably worth a little more because it's so comprehensive. But let me tell you this, at the same time, it's so useful. Here's his phone number. Write it down for now. I want you to listen to the show. At the end of the show, I'll tell you when. That's when I want you to start dialing. 860-673-7155. Again, it's 860-673-7155. By the way, when you're on the burlingtondentist.com website, hit the link to subscribe to her YouTube channel because in case you miss any of the show, if you get taken away for some reason or whatnot, or you want to watch or listen to any of the previous shows that we've recorded, you'll be able to do it at your own convenience because they're on demand. Or as they say, you can play them whenever you want on their YouTube channel. Anyhow, great to see you, Doc. Good morning.
Good morning to you.
How have you been? How's your week?
You know, every time you ask me that, I say the same thing. But it's interesting because I'm seeing more of you that are taking advantage of the free assessment. So it's good. It's very good. Yeah.
Good. I'm happy to
And
hear
people
that.
have been listening to the show.
Well,
so
yeah.
They're listening longer. And now that we're offering this free assessment, I have people who are taking advantage of that.
For them
which
not
is
to.
Great.
It would be.
Well, so everybody's finding that they probably have sleep apnea.
Well, I've learned that more people have it than not.
Yeah, right. Well, they don't know.
Oh, well, yeah. Well,
they don't know.
True.
So, and we're
Well, that
sleeping
means they
when we're
still have
sleeping while it's happening. So we don't know. Like you don't know what you don't know until you know it. I say that a lot too.
And for those of you who live alone, I mean, if you've got a spouse, whether they're laying in bed next to you or in the room down the hall, they can hear you. You know, they usually can hear snoring. They can hear some type of one of the symptoms of sleep apnea. You live alone. I don't know, unless you're recording yourself. I
do suggest to some people that they take their cell phone and see if they can record themselves during the night. And it's funny because they find out that they talk and they do snore and they do other things, but
move around, kick.
Well, yeah. So, but it's good information. Unfortunately, the wristwatch thingies don't work. The Fitbits really don't. They think
they don't
do.
work. Fitbits. I don't own one, but I know people.
They're too
swear by
vague
'em.
and they're too general, and so you might get an indicator that you should see somebody, but most of the time they're going, "I'm healthy and I'm good," and it's like. Although I had one guy that was totally obsessed with his Fitbit saying, my heart rate's going up. And I said, well, you do that when you have dreams, And he's like, well, but I don't want it to do that during the night. Well, I'm like, you can't control what you're doing at night. So, yeah, it's a thing. Not everybody has a big issue with it. He was just obsessed with his Fitbit.
I bet there are people that they're not even aware that someone like you exists, because you're so much more than a dentist. And when you had told me early on, when we first started doing the show, and I said it, in fact, I said at the beginning of this show and most shows that we do, is that there is a strong link between dental and sleep disorders. I bet a lot of people weren't even aware of that link.
So when they start having other issues, and we've talked about this on other programs as well. So periodontal disease is one that we should all be looking for sleep apnea, or some aspect of it. It may not be serious. You don't necessarily need a CPAP machine, but you should have it effectively assessed. Now, here's the other thing that complicates that. What other medications are drying out your mouth? So we know that medications dry out the mouth, and that can help promote more sleep apneic events. You can be mouth breathing that promotes the sleep apneic events. And, of course, one of my pillars and all this is nasal breathing. But getting good sleep is really what this is all about. Everything we're doing is to get you into better sleep. Why do we say that? Is because stuff happens while you're sleeping that you don't even know about. That's the time that the body then decides to repair. The growth hormones are released, so that's why children grow. It's always interesting to me, and I observed this with my own boys when they were growing up. They grow faster in the summertime. Why is that?
Because there's more sun. And,
Agreed.
things grow more with sunlight.
Agreed. There's more sunlight. So when you have more sunlight, you're developing a stronger deep sleep at night.
Oh.
So we talked about a circadian rhythm in one of the shows, right?
Yeah.
So this
Many
goes back to the circadian rhythm. So what is sunlight doing? Sunlight's your daytime vitamin D, wake you up. That's a super healthy hormone that we have in our body, and it's really strong about immune defense. And then we also have the hormone that's released while we're in the dark. And that's called melatonin.
Let's talk about melatonin.
Okay. So melatonin is part of that circadian rhythm, right? It's released as we start to get dark. There's more that starts to get released. That hormone gets released into the system, sort of preparing you to go to sleep, right?
Okay.
So it's released by a pineal gland that's part of our brain, but it also has a lot of hormones that it regulates. So people go, what are you talking about, right? So I like to say this is the balance between daylight and darkness, right? So there's a weird term for the nighttime one. I think it's something like Dracula of the dark or whatever it's called for melatonin. But we need the melatonin because that's regulating blood pressure. It's regulating heart issues. And so while we're sleeping, our body has a chance to repair. And we also are hormones are being released. Right? That's part of the repair process, right? So how do we manage all that, right? So when we've got a lot, and I've talked about this again, blue light, okay?
Not good.
So you need to put either blue light protectors on, which you can put over your eyes. You can put on like I have clip-on types that go on my reading glasses. So you want to put those on because that blue light keeps the melatonin more suppressed.
Okay.
So you're not going to release as much melatonin, and that's a whole part of preparing to go to sleep. I tell people, don't turn all the bright lights on in your house while you're in the evening. You're going to get prepared for sleep. So you might have one light on, okay, maybe two, but it's like I go around turning lights off in my house. Maybe during the day. I don't really have a lot of lights I turn on during the day. I like the lights from the windows.
Yeah, natural light.
Right, natural light. So one of the things we want to do is we want to prepare for that sleep. So what time do you go to sleep, right? Don't know. I go to bed closer to 9 or 9:30. You go like
11,
midnight?
11:30?
11:30. Okay, so you have to kind of count back from there. Like when is that time going to be important? So why do we talk about melatonin at all? Because people get jet lag, say, I need melatonin. That's only good when you're going east, not when you're going west. Okay? So think about that. Why is that? Because you're getting into the...
because you're going backwards as far
as time.
Yes, right.
So your time's getting shorter.
Correct.
So you don't want to take any melatonin, get off the plane, and be at 7 o'clock at night. And you're like, okay, I got to go to bed now. So you force yourself to stay awake a little longer. And it's easier to do that on the West Coast because it's still daylight. And then, you're going into a normal...
it's easier to acclimate yourself going west than it is east.
Correct. Now, if you're going east, you're going into the dark. You're coming in later. So if you've got a 3-hour plane flight and your bedtime's normally around, let's say, 10 o'clock at night, and you're going to land, it's like, say, 8 or 9 o'clock, right? Take your melatonin so that you're timing it for the time you normally go to bed. About 3 hours.
But what does the melatonin actually do?
So it is acting on the hormones to make you more tired. It's like this is the preparation. The brain starts to kind of shut down. Now, on a chemical level, I'm not a biochemist to do some of that. I could probably get into some.
So
of
for
that.
people having a hard time falling asleep,
so it's really great for the people
that.
who have insomnia, right? Because usually they've got too much blue light.
All right. So what about? See, I don't want to confuse you. I don't have any problem falling asleep. 11:30, I'm wiped. I'll fall right to sleep, and I get up at 4:30. So there's my 5 hours.
So you're already getting your eyes to the because the sun comes up in the summertime. So I'm sure
it's light out when I
you're driving to work.
Yeah, exactly.
Okay.
Yeah.
So that early morning sun is really already setting the timing of your melatonin. Why? Because it's now saying, okay, time to wake up. The light's coming into your eyes, and it's all done through the retina of the eye. So as the light comes in, it goes to a special place in a chiasmatic nucleus in the, they call it a suprachiasmatic nucleus in the brain, and that stimulates the hormone release. So we're releasing more things to wake up, like cortisol, right? Because cortisol wakes us up. So we start to see that increase when we're in the daylight. I like to I take my dogs out early in the morning, 5:30, 6 o'clock, and let them run around in the yard, and I sit there in the sunlight. And it's good for so you want to be out there about 10 minutes or so you get that sunlight in the eyes. Now, if you're driving to work, you get some sunlight, unless you've got all the protection on your windshield, from like sun. I don't do that on my car. But I like to be out there in the sunlight.
Yeah, me too.
All right. And then I spend more time out in the yard when I can. So, like this past couple of weekends, I'm working out in my garden, weeding and doing what I can when it's not too hot. And I do that usually early in the morning. And I'm getting a little tanner as I look at myself. And I'm like, oh, okay. That sunlight is also producing more vitamin D for me, right? So that vitamin D is also a wake you up kind of thing. And it's a great hormone because it's so important to our general health. We talk about what happens when we go to sleep, right? So we release growth hormone. We're repairing the body. We're doing all that wonderful stuff. And so for those people who can't fall asleep, this is going to be a help. I read a recent article, and it was interesting because they're now looking at melatonin and pain control. So people who have like osteoarthritis or are taking narcotics to control pain, they have to take less of the narcotic to help with the pain if they give them melatonin. Interesting, right? So we're at the beginning of kind of looking at some of that. And so some of my friends sent me a recent article that was published, and I thought, oh, this is more interesting than we think. So melatonin is another hormone, right? It's just a hormone, like vitamin D is a hormone. We can then take them and we can help get ourselves into better sleep. So those people who struggle to go to sleep, you want to take it about 3 hours before you're...
Okay, but how much? How do you know how much to take?
So that's the interesting part. So if you take too much, you get little side effects, right? Some people can't get out of bed. That's like they're too drowsy.
Yeah, right.
Right? And you have the ones that go, it didn't work, right? Well, it didn't work because you didn't give yourself enough. So I would say there's somewhere between 1 and 10 milligrams, and I know that's a big range. The sweet spot might be 3 milligrams to 4 milligrams. Some people, if they're older, they don't produce as much melatonin, so they might need a little bit more. So, but if you're in pain, typically I don't have a lot of 20-year-olds who are in pain. I have more like the 60, 70, 80-year-olds, right? And so we're looking to see, and I say just try it. Start at like 2 milligrams, maybe 3, see how you do. You might need 4 or 5 to get to that sweet spot. And interestingly, just recently, people are going, oh, that did help. Doesn't take the pain away. It's not a pain reliever, but it does boost the body's analgesic responses. So kind of interesting, right? So if you're taking a pain control medicine because you have pain while you're sleeping, because people get back pain, hip pain,
Sure.
knee pain, things like that, anything that's more bone or osteoarthritis related, I think. And once again, they're working on multiple areas in this to see really what it does do. And then they're very clear about saying they don't really know the mechanism of action. So interesting, right?
Yeah.
So once again, we're back to, because pain fragments sleep and keeps you from getting into that deep restorative sleep.
Are there, and forgive me if I'm confusing this with something else. I thought somebody told me that they were taking this and they were starting, did they get a little nauseous? Did they?
They can have side effects. So
Yes.
Too much can make you nauseous.
There you go. Okay.
Too much and there are certain people that shouldn't take it at all. I mean, like if
Well, if you don't have any problem falling asleep naturally.
Well, let's talk about women who are pregnant, people who are breastfeeding,
okay.
right? Because your hormones are already out there going cuckoo. I hate to say it, because I certainly remember when I was pregnant. And we get overheated and we have trouble sleeping when we're hot. I mean, we're basically cooling mom's body and the baby's body. So I can remember one summer I was pregnant and I was like, I lived in the basement, I swear. I was like, it was cool down there. So, and I didn't even wear a coat one winter because I was pregnant during the winter. So,
Hot flashes, Mom?
Yeah, well, you're hot.
Your hormones are out of whack.
Well, that's part of it. The other part is kind of cool for me and a baby too, So women go through a lot when they're pregnant. But yeah, so we want to also say that melatonin can be good for a lot of things, but if you're taking certain medications for depression, seizures, seizure medications, you want to be kind of careful about that. Certain diabetic medications might be interfered with, certain blood pressure medications. So, and I'm not an expert on them. I'd have to look it up literally, but it's a good thing to maybe talk to the pharmacist if you're thinking about taking melatonin to see, because they have a better access to contraindications and things that it might interfere with melatonin itself with the medications you're taking. So if you're at the pharmacy and you're picking up medications, you might want to say, can I take melatonin with this medication? So I'm always will refer to the pharmacist to say, they should do that. I can certainly look it up, but for me to turn around, I don't typically say to a lot of people, take melatonin unless they are not taking anything else.
Are there a lot of other effects that it has?
Well, it's an antioxidant. Interesting, right? So it can actually help to ward off cancer cells and negative ions that can, we talk about how they kind of bang around and they can damage DNA, which is how we get cancer, or we get those zombie cells that I was talking about in another show. So, yeah, so antioxidants, think about what gives us antioxidants? Vitamin C is an antioxidant. Blueberries are, great antioxidants. All of our fruits have some component of that. And we take those because they combat the bad stuff, right? So those are the things that cause more disruptions, toxins that we get in, air we breathe, water we drink, food that we eat. So,
Okay. Folks, you are listening to The Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at theburlingtondentist.com. More importantly, we're about 8 minutes away for you, maybe even less than, actually about 8 or 9 minutes away, where I want you to be one of the first 5 callers at the end of the show. So that way you, or someone that you know and someone that you love, could receive a free sleep assessment that we're going to be giving to the first 5 callers at the end of the show. 860-673-7155. And if you missed any of those points of contact, no worries. I'll give it to you again more towards the end of the show. But I would say stay by your phone because we're about 8 or 9 minutes away from you calling to obtain that. Please continue.
Well, so I brought a couple of notes just because I think it's always interesting to read the more traditional research that's out there. So melatonin has various therapeutic functions, right? So it helps with insomnia, sleep-related breathing disorders, which is really where my specialty is, hypersomnolence, circadian rhythm, sleep-wake disorders. Maybe they've got their system screwed up. And that happens to shift workers, so like the people who are working at the night and they're sleeping during the day, right? So they might need a little bit of, as long as they're not taking a lot of medications. So who typically gets the third shift are the the entry-level people, right?
Sure.
You get a few that like the nighttime
hospitals,
thing.
Police,
right. Paramedics,
sure. Paramedics,
right? All of those guys. So if you're not taking if you're not taking any medications, then you're probably pretty free to take some melatonin. And I'd start with, especially with the younger you are, like 1. So start taking 1, see if 1 does it. It might be 2 milligrams, 3 milligrams. But at that point, if depending on your age, I wouldn't go too much more because those side effects are another little thing that can happen, right? So you can be so tired you can't get up in the morning or when it's time for you to get up. So so as I was saying, so it helps with sleep-wake, and it's an alternative treatment to currently available pharmaceutical therapies for sleep disorders with significantly less side effects. Interesting. So I go back to, why is it important to have that sleep-wake, that circadian rhythm, the sleep-wake kind of dynamics, right? So we look at that blue light, and I keep saying, because everybody's on their phones, they're on something until they go to bed, right? Now, TVs put off some blue light, too. So if the kids are right smack up in front of the TV, not such a good idea, right? So we tell people you got to be at least 6 feet away from the TVs. Most people don't sit right up there, but my kids tried to when they were little. They wanted to be right up next to,
It's
Big Bird.
typical for kids, right? Of course, they think the closer that they are to the television, it's also messing up their eyes. By the way, they don't need to be that close.
I was just kind of discouraging some of that. Okay, so melatonin prevents a well-recognized increase in glucose levels that usually follow exposure to intermittent hypoxia during sleep apnea. Okay, interesting. So that's where that melatonin, getting enough melatonin is really important. As we age, that melatonin amount in our body decreases. Same with vitamin D, okay? Because we don't convert the vitamin D in our skin as efficiently as we get older. Okay? And especially if we're not taking so I go back to what's in our skin that helps to convert that is a lot of cholesterol, right? So people go, cholesterol is bad. Cholesterol is not bad. We need cholesterol. 65% of our brain is made of cholesterol. So
the good cholesterol, right?
Oh, the only kind.
Yeah.
The only kind. So, and it's in every cell wall in our body. We have cholesterol. So when we take these cholesterol-reducing statin drugs, I particularly have a problem. You couldn't pay me to go on a statin drug. I will absolutely do a whole lot of other things before I go on a statin drug because it's not exclusive about where it takes it from. You think it's only going to take it out of the arteries, or somebody's assuming that. And I'm like, I see a lot of dementia with people who have been on statin drugs. I see people get myalgia. What is myalgia? It's a muscle pain from that. And that's because...
Like fibromyalgia?
No. It's a muscle inflammation, myalgia. Okay? People come on, it's like, I can't stand up. My muscles hurt. Everything is crazy, right?
Okay.
So why is that? And we go, this is why I say when I read these things, I'm like, what? How is that working? How is that all interrelated? And we're depleting you of CoQ10. Now, some people don't know what CoQ10 is, but it's an essential ingredient in the Krebs cycle. Remember that biology we had in high school? We had to memorize that stupid cycle. I hated it at that time. I was like, what does this have to do with the price of eggs, right? So, but unfortunately, it's really important. And statin drugs deplete your CoQ10. So people get, and I had a brother-in-law who was on a statin drug, and he thought he was dying of cancer. He was like, there's something wrong with me. He's like, and he was losing weight. He was losing muscle mass. Interesting. When they finally took him off the statin drug, all that went away.
Really?
So, yeah. CoQ10 is very essential. They're trying to put it into the statin drugs, but if you take a statin drug that doesn't have it, or you're not getting enough for your body, you need to take additional CoQ10. And so there we're back to why is it that we have these issues? So the hypoxia is in sleep apnea. Remember, we stop breathing, we lose our oxygen. So how bad is that? That's why we call it intermittent hypoxia, right? I just want to make sure the terminology is good. So melatonin protects against chronic intermittent cardiac hypertrophy. Think about that. When we stress the heart, we get an enlarged heart. Sleep apnea does that. Right. All right. So then we also get issues with how the heart contracts. And I think this is also it contributes. So the mechanisms of having heart issues from sleep apnea, you get cardiac inflammation, vascular dysfunction, and secondary hypertension. But melatonin can help with all that. So having enough melatonin in your body while you're sleeping is really important. Right. So it has a protective effect. And it's an antioxidant, so it's helping the body to heal as we're sleeping.
Incredible.
So that's back to that circadian rhythm. So when I say I go to bed at a certain time and I get up at a certain time and I do that every day, I'm not kidding.
I've only got 3 minutes. You touched on something, and I meant to take it a little bit further. We were talking about people who should not be taking melatonin. You were talking about pregnant women.
Yep, breastfeeding.
Okay, breastfeeding, right. Those are two.
Ones that are taking certain medications.
Okay, that's where I wanted to go. Are there, can you name some of those certain medications?
I'm not familiar
Okay.
with that
Okay.
particularly. I don't have a list of that. I just know that we need to be cautious. And that's why I'm saying they can check with their pharmacist to say, hey, is there anything in here that I'm taking that I shouldn't take melatonin with? Right? And the pharmacy they got those computers. They look that stuff up in a heartbeat. I can look it up, but I don't typically say to people, just take melatonin. But you need to understand why it's important to get into that circadian rhythm, and that's what generates that melatonin release. As it's getting darker, our melatonin starts to pick up and we get released. Like when we wake up in the morning, the cortisol does the same thing. That's why we're happy people when we wake up, right?
Especially in the summer because there's more daylight.
Yes, exactly.
Darker, as people get, right?
It's
they
true.
get the blues in the winter because there's less daylight.
Exactly.
Right?
Exactly. And that's when having light
It's a real
supplements,
thing.
having light supplements in your home is helpful. And we talk about red light therapy.
I've only got about 2.5 minutes. Could you do me a favor? Can you quickly? Is there something? Did you want to finish off on something? Could you go over your sleep assessment? We weren't able to do that last week. I didn't want to go 2 weeks because I'm going to have people call in about 2 minutes, or less than about a minute and a half.
So the sleep assessment, and I will tell you, since I've been talking about the form, everybody's doing really great. I'm like so proud of you all. So yes, you want to fill out the form, and people are really taking the time and they're filling it out, and it's complete. So thank you, thank you, thank you. Because I'm only going to give you a half hour of my time for free. And that half hour, I don't want to spend it asking you the questions that are on the form. So I can read through the form very quickly, and then we can get to the essence of what it is that they're concerned about, right, when they come in. I had one lady who was like, I don't know if I have a TMJ problem. And I said, well, sleep apnea causes TMJ.
Let's find out.
Exactly. So as we went through her assessment, she didn't realize she couldn't open very wide.
Ooh.
Right. So she was very low. And yet there are people that I check and they have no problems with the TMJ, but they've got postural problems. We've got forward head. And you hear me talk about those things, right? And sure as shooting, they're grinding and doing some things in their mouth as well.
All right. So it's a pretty comprehensive form, but it saves a lot of time so that when they come in and meet with you, the full half hour can be really dedicated to specifically
what their issues are.
What their issue is. Okay. Yeah. So I would say, my friends, as I told you at the beginning of the show, call right now. We're wrapping up the show. So right now is very fair. Be one of the first 5 callers right now. You're going to get a free sleep assessment. Could be for you, could be with your spouse, your children, your grandchildren, a loved one. It's about a $250 value. So she puts that. I think it's worth more, but that's here's the number. Write this down. Better yet, call it right now. 860-673-7155. Again, 860-673-7155. Online at theburlingtondentist.com. When you're there, hit the link to subscribe to her YouTube channel. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning. Have a good one, everybody. So long.